Hello everyone and welcome back to the channel. In today's video we're going to discuss the new FDA approved drug Leqembi, also known as Lecanemab, which has shown to slow the progression of cognitive decline in those diagnosed with Alzheimer's disease. Up until now there has only been drugs available that treat symptoms of dementia. Leqembi is the first FDA approved drug that actually treats the underlying disease process by removing amyloid plaques. Amyloid plaques are misfolded proteins that build up and form in the spaces between nerve cells and can cause neurofibrillary tangles. The buildup of these plaques and tangles damages neurons in the brain and is what causes Alzheimer's disease. A couple important things to note about the new drug. The target recipient of Leqembi are those that have been diagnosed with mild cognitive impairment or mild Alzheimer's disease with confirmation of those elevated amyloid plaques. So it is only indicated for those in the early stages of the disease, and you'll need a brain scan or PET scan to confirm the presence of those amyloid proteins. Leqembi is not a cure for Alzheimer's, but it is a big step forward in the treatment of the disease. Worldwide, there are 55 million people living with Alzheimer's or other dementia-related diseases. 6 million of those are in the US, and it ranks number 7 as a leading cause of death in the US. So all of those that are impacted by this disease are hoping for a cure to be found one day. For those with mild cognitive impairment, this new drug could give you more time before the disease advances, more time to maintain your independence while cure research is still being conducted. As with most medications, there are side effects, and the risk and benefits should be discussed with your doctor and family before taking any course of action. One of the most widely talked about side effects of this drug is ARIA, which is swelling and or bleeding of the brain. Sounds pretty scary, but from what I've read, the bleeding was referred to as microhemorrhaging, and it was only serious in a low number of cases. The potential side effects of ARIA are monitored with MRIs throughout the course of the treatment. The drug is administered intravenously twice a month for 18 months. The cost is $26,500 per year. Medicaid will cover a portion of the cost, but there will be other potential high out-of-pocket expenses related to doctor visits and brain scans to determine if you qualify for the treatment. A few of you have reached out to me and asked me about the new drug and if Theresa would be a candidate for it. Unfortunately, Theresa is in the later stages of the disease, so she would not be a candidate. For those of you brand new to the channel, my wife Theresa was diagnosed with early onset Alzheimer's disease back in 2018 at the age of 49. If this drug was available back then, I'm certain she would have wanted to try it, and I would have absolutely supported that decision as well. The loss of her independence was an especially hard thing for Theresa and very difficult for me to watch her endure. This new drug shows promise in enabling those in the early stages of the disease to maintain that independence a little longer. It was back in 1901, a 51-year-old woman by the name of August Dieter became a patient of Dr. Eloise Alzheimer. August was displaying unusual behavior, including short-term memory loss, and she died 5 years later. Her brain was examined by Dr. Alzheimer's, and he found the hallmark signs of the disease, those amyloid plaques and tangles. The disease was then later named after him. So discovery of Alzheimer's disease occurred back in the early 1900s, and no medication has been available up until now that actually treats the pathology of it. I'm a big proponent of early detection and treatment. I'm making this video today for those that may not have heard about this new drug. Maybe you yourself or someone you love is showing signs of mild cognitive impairment, and you or your loved one has not been to see a doctor yet. Please make that appointment. Discuss the risk and benefit of this new drug with your doctor and your family. Don't be ashamed and don't delay. That's going to be it for today, guys. I appreciate you watching. Thanks for the love and support. We'll see you in the next video, and I'll chat with you in the comments. Take care, everyone.